Doctor, how can I find out about my egg reserve?
Yes, egg reserve is a very important concept for women, because women are born with a certain amount of eggs, a specific egg reserve in their ovaries. Although there are various factors that can affect this, what actually determines a woman's fertility is the amount of this reserve in the ovaries and when it will be depleted. That's why determining ovarian reserve is one of the main tests in evaluating women's infertility and fertility problems. There are several tests we use to assess ovarian reserve. These are hormonal tests. These tests can include measuring anti-Müllerian hormone levels, FSH and E2, as well as evaluating the antral follicles, what we call candidate follicles, within the ovaries by ultrasound, which is also one of the ovarian reserve tests. An important point to remember about ovarian reserve tests is that ovarian reserves are dynamic. In other words, a woman who had a very good ovarian reserve a year ago could experience a significant decrease in her ovarian reserve the following year. This could be due to reasons the patient can understand, like chemotherapy or radiotherapy, or it could happen without any apparent reason, simply because of her genetic background, causing her ovarian reserve to deplete rapidly. That's why patients need to understand that this is a dynamic process, and having a good ovarian reserve 2 or 3 years ago does not guarantee that it will still be good 3 years later.